Hello, welcome back to episode number 5. We are almost halfway through 12 days of Skinmas. How are you guys feeling about the videos? Are the videos helpful? Make sure you drop a comment for me down below so I know what type of content to bring to you in the future. But again, my name is Ashanti. I'm a licensed esthetician of 8 years, and today I'm going to bring a video to you about hyperpigmentation, but specifically hyperpigmentation for people of color, for skin of color, and how to treat the hyperpigmentation, what causes the hyperpigmentation, and what in-room treatments you can get to help push the needle forward in your process of removing the hyperpigmentation, and also to prevent the pigmentation in the future. So go ahead and hit that subscribe button, like that for me, give me a thumbs up, and let's get into the video. So by definition, hyperpigmentation is an overproduction of melanocytes in a specific area. So it can be anywhere on the body, whether it's on the face or on the body. It can be on the hands, on the knuckles. It can be on your back, on your neck. And there are specific things that do cause this type of hyperpigmentation. Sun damage, medication, receiving the wrong types of treatments, as well as diseases like lupus, Addison's disease, eczema, and also leftover scarring from acne. So that would be post-inflammatory hyperpigmentation. Melasma is also another hyperpigmented disease that we see a lot, especially in women of color and especially around the time of pregnancy, which is why it also has the nickname as the pregnancy mask. You'll see the melasma around this area, also on the neck. So the best ingredients for someone dealing with hyperpigmentation that is skin of color, it's for me going to be AHAs. Those are going to be alpha hydroxy acids. And so if you haven't taken a look at my previous video about chemical exfoliates and physical exfoliates, make sure you check that out because I break down the difference between AHAs, so alpha hydroxy acids, BHAs, beta hydroxy acids, and then PHAs, polyhydroxy acids. Some of those acids would be glycolic acid, mandelic acid, or retinol, and then also kojic acid. Kojic acid is a rice derivative and also one of my favorite ingredients to use for hyperpigmentation. It is also antimicrobial, which means it's going to be really helpful in aiding the acne condition to make sure that we are keeping the acne vulgaris away and also helping to prevent the acne from coming back. When you're using these types of acids at home, the most effective way to use the acid is as an exfoliation. So you can do something like an at-home peel, like from Dr. Dennis Gross. He has the mini square peels that you can just apply to your skin a few times a week. When you are doing these types of treatments on yourself, you want to make sure that you are using your sunscreen. You want to make sure that you're going to bed using your occlusive so that you're locking in everything and you are helping to repair the skin barrier once you do use an acid like glycolic acid or like a retinol. So you want to make sure that you're also not combining these acids. So you don't want to use a glycolic acid with a retinol all at the same time. You want to give your skin time to recover. You can also use these in a form of a serum. I like serums because they do penetrate deeper into the skin, as well as like an at-home chemical peel to exfoliate the skin, rather a cream. Sometimes the cream tends to kind of just, sit on top. So using a serum that's going to help penetrate the skin will really help aid in faster results for getting rid of your hyperpigmentation. Now, if you want to take it a step further, especially if you're dealing with something like melasma, then you want to go in and get yourself a treatment. Of course, the very first thing you want to do is make sure that this person is certified or the office is certified and that they specialize in skin of color. That is very important because our genetic makeup is different. So we do need someone that specializes in our skin type. and our skin tone and knows how to work with our skin type and skin tone, and knows what to look for if there are any discrepancies going on while the treatment is happening. Do that by checking reviews, making sure that you're looking them up. Do some research before you actually go into the office. I'll always suggest that before you actually see a provider, make sure that you're doing some research on them. To be certified, this person should be a specialist, and they are going to go ahead and let you know what would be best for your skin type. You may have melasma, but you may also have sensitive skin. You may be normal skin. You may have dry or oily, or you may have acne prone skin. So all of that is going to come into play when they decide what treatment works best for you. But these are just some ideas of the types of treatments that you can get to help reduce the hyperpigmentation. So like I stated with the peels, you're going to do an in-office peel, which is going to be way more potent than a at-home chemical peel, which really is more of just a at-home exfoliation. So a chemical peel that you would go into the office to get with something like a glycolic acid peel, a vitamin A peel. On the higher level, that would be a TCA or a Jessner. But again, you have to make sure that this person or this office is certified and specialized specifically in skin of color. Mandelic acid enzyme mask, this will be really good as well in conjunction with a treatment like microdermabrasion or microneedling or pore cell treatment. This is something that would really help to work with getting the hyperpigmentation removed and at a faster rate. And I can't stress enough, I know sometimes with social media, we see the girls going in to see their physicians and their estheticians, their dermatologists, and it looks so relaxing and rejuvenating. But again, you have to make sure that you're going to the right person, and also that you are going to be doing your work at home. So if you're getting these types of treatments, you want to make sure the number one thing you're doing is using sunscreen. Using treatments like glycolic acid, mandelic acid, any type of acid really, is going to make you more sensitive, prone to the sun. So you want to make sure that you are using sunscreen, reapplying your sunscreen, and I would say go for a sunscreen that's both mineral and physical. That's going to give you really good coverage. If you just had the treatment, try to schedule your treatment where you do have some downtime, where you're not having to be out in the sun the day after you receive the treatment. So this isn't something where you get done and then go hang out at the beach. Definitely don't want to do that. So again, even if you're just kind of running to the store, you would make sure that you have a hat on, that it's covering. Also, of course, wearing your sunscreen, and then applying sunglasses and things like that to help reduce the amount of sun exposure your skin is receiving while you're outside. And lastly, I do want to talk about the risks of laser treatments for skin of color. So it's not that we can't receive laser treatments, but I have been seeing the internet go crazy, especially lately, of so many treatments, so many people that have received bad treatments of laser, and also chemical peels too. Like these chemical peel reactions and the reactions to laser, they have been just terrible. Some of them have been terrible, and it really hurts my heart because it's like 10 times worse to get rid of that burn from a chemical burn or a laser burn. And so that's why I'm really adamant on making sure that you guys do your research before you go in to receive these treatments, making sure that they are certified, and also why I'm speaking specifically to skin of color, specifically to Black people, because our skin is different. That you are looking for, like I stated before, making sure that they're accredited, making sure that they're specialized in skin of color, but also making sure that you have open communication with them, so that when you leave the office, that isn't it. That's not the door shuts and then you're never able to speak to them again, because you don't know exactly how your skin is going to react afterwards. So looking looking for a line of open communication, and also, are they knowledgeable with you? Are they giving you all of the information that you need to make sure that you're doing your part once you leave when it comes to home care and after treatment? And that is it for today's video. Again, another short and sweet, straight to the point, but I hope that this was helpful for you, and I hope that it has kind of helped to push you in the right direction when it comes to figuring out what types of treatments you want to use for your hyperpigmentation, as well as the types of ingredients that you want to use for your hyperpigmentation. So again, my name is Ashanti. I'm a licensed medical esthetician of 8 years, and this was episode number 5 of 12 Days of Skinmas. Make sure you join me tomorrow for the next video, and I will see you guys then. Thank you for watching.